Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. When you start hormone therapy in menopause matters, break-in number 148, for women weighing whether to use estrogen to manage hot flashes, sleep issues and other bothersome symptoms as menopause approaches, it may make sense not to wait. Break new research shows that perimenopausal women who had used estrogen for at least 10 years before their periods stopped for good had 60% lower odds for breast cancer, heart attack and stroke, compared to women who never took hormones. The findings were scheduled for presentation at a meeting of the Menopause Society in Orlando, Florida, which continues through Saturday. There has long been a debate about if and when estrogen therapy should begin, so hopefully the use of large-scale electronic health record data will help resolve that question, lead author Chidi of Case Western Reserve University School of Medicine in Cleveland said in a news release. Hopefully, these results start a larger conversation about prevention in women's health. As menopause and number 148, the end of a woman's menstrual periods and number 148, approaches, a large percentage of women experience annoying symptoms. Hot flashes and sleep disturbances are common during this transition, which is called perimenopause. And perimenopause can last for several years, as hormone levels wax and wane. While estrogen therapy, once controversial, has been shown effective and safe, according to the Menopause Society, long-term data about when to begin has been lacking. For the study, Chidi's team analyzed records from more than 120 million patients. They included women who used estrogen for at least 10 years before menopause, menopausal women currently using the hormone, and menopausal women not using estrogen. The study found that women who waited until after menopause to begin estrogen therapy had slightly lower odds of breast cancer and heart attack than those who never took hormones. But they also had a 4.9% higher likelihood of having a stroke than the non-estrogen group. The findings of this study suggest lower risk and potentially greater benefit of estrogen-based therapy when started in perimenopause, Dr. Stephanie Fobian, medical director for the Menopause Society, said in a news release. She noted that the study's desig less than speak greater than N may be subject to bias, but added that the findings may pave the way for additional research on the risks and benefits of hormone therapy when initiated earlier in the menopause transition. Clinical research is needed to confirm the findings and to explore the long-term effects of estrogen therapy at different stages of menopause. Research presented at meetings should be considered preliminary until published in a peer-reviewed journal. Sources: The Menopause Society, news release, October 21, 2025. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. And copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. More news resources for MedWatch. Drug alerts daily. Med news for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than speak.